Myth number one. Let's see. Obamacare cuts Medicare benefits. Not only are no guaranteed benefit cuts, but we add benefits, such as free preventive services and the annual wellness visit. 32 million seniors and people with disabilities on Medicare have already used at least one preventive service. Myth number two, Obamacare raises premiums. In fact, there's even a viral email, supposedly from Blue Cross Blue Shield, Alabama, that falsely says the Medicare monthly premium will be $247 in 2014. Myth. Busted. And here's the fact. Blue Cross Blue Shield Alabama states the information is, quote, inaccurate, unquote, and erroneous, unquote, and is, quote, not their position. On page 218 of this year's trustees report, the projection is premiums will be $115.80 in 2014. Nothing like $247. Seniors, if you get that email, spread the truth. Myth number three, seniors and people with disabilities would be better off with private insurance and with the vouchers provided in the Republican budget. Myth busted. According to a recent Commonwealth Fund report, seniors and people with disabilities on Medicare are more satisfied, report fewer access problems, and fewer financial burdens than those on private insurance. Medicare is more efficient and has lower administrative costs, 3% overhead for Medicare compared to 15 to 20% for private insurance. Next myth. Seniors are denied access to care. One viral email says anyone over 76 years old can't get cancer care because of Obamacare. Myth busted. Fact. This is really important. There is no rationing in Medicare or Obamacare. In fact, by eliminating cost sharing for many screenings, we will all be able to get care to seniors and people with disabilities sooner. Okay, myth. Next myth. Obamacare weakens Medicare by cutting $500 billion in spending. Myth busted. Fact. Obamacare doesn't cut any Medicare guaranteed benefits or increase anybody's cost sharing. It does cut $160 billion in excess payments to private insurers, will stop subsidizing private insurance companies, and creates new tools to reduce waste and fraud. We're happy about that. We want to cut the cost of Medicare by getting rid of waste and fraud, don't we? And it uses savings to improve Medicare by closing the donut hole, the gap in coverage on the prescription drugs. In fact, 5.3 million seniors have already saved $3.7 billion, and by improving other benefits. And it adds 8 years to the solvency of Medicare. Okay, myth. Myth. The Republican voucher plan to turn seniors, people with disabilities, over to private insurance will work for them. Myth busted. Fact. The Republican plan doesn't lower costs. It simply shifts them onto the backs of seniors and people with disabilities. It will double out-of-pocket costs and leave people to the mercy of private insurers who didn't want them in the first place, and that's why Medicare was created. And I've got one more good one. Here's a myth. The myth is most seniors are wealthy. Some even call them, I've even heard it said that they're called greedy geezers and can afford to pay higher premiums. Myth busted. The median senior household income is $22,000 a year. Less than 1% of older Americans, senior citizens, have incomes over $250,000. Half of all people on Medicare have retirement account savings less than $2,100 and less than $31,000 in any other financial assets. The average person on Medicare spends 16.6% of their income on health care, and that percentage rises with age. And so, as I said earlier, my friends, advocates, seniors, people who are interested in the truth, we have to go around not necessarily with a safety pin poking at things, but with the truth to bust the myths about Medicare and to celebrate its 47th birthday.